Caring for and empowering women as they struggle with poverty and homelessness has always been part of the mission of the Sisters of Providence since their founding by a young widow, Emily Tavernier Gamlin, in Montreal, Quebec, in 1843. Emily was moved by the love of Christ to serve the many poor, hungry, and sick people who lived around her. The people looked upon Emily as Providence for the needy and named her work Providence. One of the sisters from Montreal, Mother Joseph, and 4 other sisters brought their passion for that mission with them when they arrived as pioneers in Fort Vancouver, Washington Territory in 1856. They opened their small home to orphans and the elderly and began the first permanent school and later the first permanent hospital in the Northwest. That small but dedicated group of sisters extended their ministry to caring for the sick and the mentally ill as they continued to break new ground in the midst of challenging circumstances. They provided an infrastructure for their good works by forming one of the oldest still existing nonprofit corporations in the region and supported their endeavors financially through begging tours in the mines and in the frontier towns. Mother Joseph died in Vancouver in 1902, but her legacy of compassion and service to the poor and the vulnerable continues today in the province that bears her name, Mother Joseph Province, which includes Alaska, Washington, Oregon, California, Idaho, Montana, and El Salvador. Worldwide, the religious community is composed of 4 provinces spread across Canada, the United States, Chile, El Salvador, Argentina, Egypt, the Philippines, Haiti, and Cameroon. Our mission is to proclaim the mysteries of Providence and our Mother of Sorrows in compassionate love and creative prophetic solidarity with the poor. In 1960, just 104 years after arriving in the West, the Sisters of Providence had founded 22 hospitals, 1 college, 9 academies, 12 parish schools, 4 homes for the elderly, and 3 other care facilities. By 1974, there were 17 hospitals, 1 high school, 1 college, and several care centers for children or the elderly. Lay people always have been involved in our diverse ministries, which include teaching, caring for the sick, elderly, and children, creating community through housing for women with children and others, feeding the hungry, being with people with AIDS and the dying, pastoral care, spiritual direction, and retreat and parish ministries. Beginning in the mid-1970s, lay people played a more formal leadership role in the ministries, particularly in healthcare, as administrators, staff members, and volunteers. New ministries serving the poor and the vulnerable blossomed in this spirit of collaboration. In 1979, the sisters opened Providence Hospitality House in Seattle, a short-term shelter for women in transition and their children. 7 years later, 4 religious communities, including the Sisters of Providence, came together to launch Transitions, a program in Spokane focused on women and children that since has grown in size and in scope. Sojourner Place, a ministry offering housing and supportive services to women in transition in Seattle, was founded by the Sisters of Providence in 1987. At the end of 2013, Mother Joseph Province included 134 sisters and 266 Providence associates, men and women of various religions who share the mission and the spirituality of the Sisters of Providence, but do not seek vowed membership. The work and reach of Providence continues to expand through the thousands of lay people employed by Providence Health and Services. The name Providence is a familiar one around Spokane. Providence healthcare institutions here include Providence Sacred Heart Medical Center and Children's Hospital, Providence Holy Family Hospital, Providence St. Joseph Care Center, Providence Adult Day Health, and Providence VNA Home Health.